So, look, thank y'all for coming today. I tell you what, it's been a while since we've had a chance to talk, and I see you brought Liz Lord with you. So, tell us all about that. You're new to the Nash County Health Department, and I think that's great. So, what's going on?
Yeah. Well, Liz, you've been here over a year now.
I have.
A year this past November. So
December 1st.
December 1st. Yeah. She's our deputy health director.
I think that is fantastic. Really do.
And that has helped me quite a bit because I serve in two roles as health director and then health and human services
Well,
director.
you seem a lot more rested. It's all I can say. You're bright-eyed, bushy-tailed.
Good. Something's working.
That's right.
Yeah.
Liz is obviously toting all the burdens of the world in the health department.
That's a good idea. We'll start more tomorrow.
There you go. Why not?
Yeah, that's a good idea.
So tell me what's going on in the health department. There have been a couple changes. I know you've done some consolidation of locations. So let's talk about that a little bit.
Well, Liz and I are talking about the consolidated project and then our community health assessment.
Okay.
But before we get to that, the last time we met, we talked about COVID.
Yeah,
and we've
did.
been talking about COVID.
Yeah,
and then we were finishing up COVID.
That's right.
And thank goodness we had a very light winter with COVID. It was very low volume kind of outbreak with COVID. We just didn't have, but we had a lot of flu.
I was going to say, but the flu's been kicking a lot of people's rear ends.
That with mortality. We had 12 to 15 flu-related deaths right in Nash County this past year. Mainly comorbidities were involved. With, of course, elderly is a comorbidity in itself, but people that resided in nursing homes and assisted living facilities. So we did have a tough flu season, but we think we peaked out around the end of February, first week or so in March.
Well, that's fantastic news. And I can tell you this, a number of people I know that have had it told me they almost wanted to be dead several times during the course of that thing. It was a particularly tough strain. And so far, and hopefully I won't, I have missed that and got lucky because I didn't take a flu shot this year. And I normally do, just didn't get around to it.
Yeah.
Well, and we think the flu shot was about 55% effective.
Right.
As opposed to something we'll talk about later, the measles immunization. That's highly effective, but we'll get to that a little later possibly.
Yeah. No, I'd love to. So let's start. Let's get it going.
Okay, with measles. Liz, we've been talking about measles for quite a while. We've been looking at it circulate and outbreak into Texas, New Mexico, and several other states.
And I understand that population has been largely unvaccinated. Is that right, that have had the measles so far?
Liz, talk about it.
Yeah. So the folks who are being diagnosed or are getting measles are largely unvaccinated. That's right. So it's a Mennonite community that has been.
Okay. And, that's interesting because they traditionally have not been fan of vaccines anyway, right? So this is not like it's a new political movement here. This is a population that historically has not sought out. So and of course, if you don't go to the public school system, there's really no mandate to get these vaccinations, or is there?
Well, it should be.
There should be. I agree with that.
In the voucher in the private school system, but it is by state law in North Carolina also.
And I imagine Texas, but I don't know that.
But the school system's the gate that catches them usually. Do they get expelled in 30 days, or we use a different word? They have to leave school in 30 days if they're not immunized.
Well, I remember my children, I had to have it as a ticket for them to get in. That's kind of how I remember it.
That's right.
But they do allow religious exemptions.
Okay, all right.
So in North Carolina.
And medical exemptions.
And medical exemptions, correct.
But with measles, it was basically, and correct me if I'm wrong, eradicated in the United States around the year 2000 or so.
Yeah, I think the word that I've seen them eliminated.
Yeah. Now, eradicated, we use so much for smallpox.
Right.
That was eradicated, but we basically had no measles in the United States, and now we've got a recurrence of measles.
So what do we think caused the outbreak?
Unvaccinated or undervaccinated population.
Okay.
That's where it attracts.
But the germ has to come from somewhere, and I just don't understand that. I mean, so it didn't just appear in the air, does it?
Well, it doesn't. It has to appear from somewhere.
Okay.
But a contagious person has a hard time transmitting it to a vaccinated person or a community where you have herd immunity.
Right. Okay.
And that's why we like to keep that along the 96, 7% percentage level
Right.
in your community. The
Right.
vaccination
Particularly
rate.
for measles because it's so contagious.
Right.
Things that aren't quite as contagious, you can have lower vaccination rates for herd immunity.
Sure.
But because measles is so, it hangs in the air for 2 hours.
Oh, wow.
After.
Oh, wow.
You know, it's just
I was getting ready to say
extremely-
you can this person can sneeze or cough
Sure.
with the droplets
Sure.
and leave the room, and 2 hours later you could possibly contract.
That's
measles.
unbelievable to me.
Yeah, it's that good. But the good part with the measles vaccination, there are 2 shots.
2 shots.
The first one gives you about 94%
Okay.
protection. Hey, that's a pretty good deal. One shot getting 94% guarantee or just about a guarantee. And the second shot picks you up to about 97%
Okay.
protection.
All right.
Yeah. And people typically, it's brought into a community through travel.
Okay.
So you've
Oh,
got
okay.
someone in this community in
Sure.
Texas who maybe traveled somewhere
Well,
where
just
it's
across the
not.
border to Mexico, right? That wouldn't be
Absolutely.
inconceivable, right? It's not that far.
Yeah,
Right.
not far across from
Yeah.
the Gulf of America.
Sure.
And
That's right. That's right. You'll get me in trouble here. No?
Yeah. Yeah. And
Whatever Gulf you want to say. But I'm with you.
I couldn't resist.
It's perfect. I teed it up for you.
Yeah.
You did.
And you bring home an unwanted souvenir.
There you
So,
go. I
little
get
measles.
it. I get it. I
Yeah.
get it. Well, if it's
Tag
2
it.
hours, it can even be an object for that matter.
That's right.
Yeah.
Surfaces.
Yeah,
and
sure.
Those kinds of things.
Yeah.
But we've got, we've had that vaccine that's called MMR.
Okay.
Hey, you get a three for one shot deal.
Mm-hmm.
You get measles, mumps, and rubella all in one shot.
Right.
And that's what we've all had. And, I was just reading today, earlier, about the, most of us that were born before a certain year, at least those that were born before 57, 58, probably had measles. But if you've had measles, there's a pretty good chance you've got a lifetime immunity.
Okay.
So I read that this morning. I read it 2 or 3 times. I'm really not real sure that's a guarantee, but at least a lifetime immunity. And if you've had the 2 shots, it's a pretty good chance you've got a lifetime immunity. with that.
See, that's
But-
that's impactful. You don't even need a booster.
that's right. And if you're in doubt, you
Get
can
another one.
get another one. It won't hurt
That's
you.
it.
Yeah. You can't OD on it.
Or you could get a blood titer to see if you've got
You
that
can.
antibody
Okay.
blood titer,
Okay.
see if
Yeah.
you got that protection.
Well, great. That's great.
And the important thing is we don't have any measles in North Carolina as I speak.
Praise the Lord, right?
That means Nash County
I'm with you.
and the Rocky Mountain community.
That's right. Well, that's good.
Yeah, that's a good thing. We don't want it here either.
No, sir. I'm seeing the pictures in the TV broadcast, and it just looks pretty bad.
Yeah, sure does.
Yeah. So, comprehensive the consolidation plan and all that's going on. What's cooking there?
Well, Liz, we're going to both talk about that a little bit. We've been talking about it a lot internally.
Yeah, I bet you
and,
have.
And with our staff, and as late as yesterday, we met with our architects.
Yes.
To
we
look
did.
at this consolidated health department concept, model, and reality that will come probably in 2026.
Okay.
It may take that long for the renovation to take place.
Sure.
But it's going to be on the hospital campus
Right.
in an existing building that's owned by Nash County.
Okay.
The old Nash Edgecombe Mental Health, or
Sure,
more recently,
sure.
East Point Mental Health.
Yeah, I know exactly where you work.
Right,
Where the old home health agency used to be. Nash County Home Health
Exactly.
used to
We were in about 5,000 feet at the far left side of that building.
Right.
And we're still in that building with our case management folks.
be. Okay.
Correct.
Well, that's a great location. So, I'm guessing all transportation systems lead to the hospital. I know everything from Rocky Mount does.
Yeah.
I'm assuming the same is true for Nashville.
There is a Tar River Transit bus stop
Right.
right in front of the building.
Right.
So
Right.
very hopefully convenient to have
And I'm
that
guessing
stop
that's
there.
part of the whole methodology or thought process behind locating it at the hospital, beside the obvious, said the hospital.
Correct.
So I know the one downtown Rocky Mount is going to move there. You consolidating any other
Nashville and Rocky Mountain.
Nashville and Rocky Mount are going to consolidate to the old East
That's
Point
right.
building. Okay.
Correct.
So we will most likely vacate that Nashville building
Right.
and our Rocky Mount office and
Right.
move to this one consolidated office, which I think will offer some efficiency.
Sure. Well,
Instead of shifting staff back and forth, it will offer some efficiency. And not to mention, it's in a pretty good medical environment or community where we're very close to our Nash OBGYNs that
Right.
actually service our
Right.
patients in
Right.
many times,
Yeah.
at least once a week.
Yep. Their doctors come to our Rocky Mount office now Wednesday mornings.
So where did y'all come about this plan? I mean, what was the thought process, the genesis moment when you said, oh, you know what, it makes sense to kind of consolidate this? I mean, I hate to lose it downtown Rocky Mount, not far from the office, but at the same time, there's not a whole lot of people that live within walking distance of that office here either. So, public transportation fits. So I get it. I do understand it.
And I'm kind of smiling because Liz did a study working with the walking traffic that came in. And you probably did 2 or 3 different studies of looking at Nashville office, looking at Rocky Mount. And very, very few walked into our office. We did that survey a couple of times over in the Rocky Mount office.
We did different seasons to take into account weather. And
I'm just curious, how many people walked in?
Yeah.
It was
very few,
okay. Maybe 2% or less.
Oh, wow.
That walk.
Almost. What are your encounters there? It's got to be like tens of thousands.
We have about 16,000, 18,000 visits a year.
Right. Okay.
So people coming in.
I'm going to call that an encounter or a person or whatever. So
appointments, people coming in.
Sure.
And that's just our clinic.
And if you look at the number of services, it really balloons out to 40, 50, or 60,000 different services we provide.
So literally only a couple hundred people walked in the course of an entire year. That's like one person a day.
I would
not even that many.
Wow.
So with the consolidation, it's been talked about for a pretty good while.
Sure.
And we were being held back by the former residents or the folks at East Point.
Okay, well, that's true. That's true.
I
forgot there was a whole rift there between the county and East Point. That's right. Yeah.
But finally, with that group vacating the building, it allowed for us to go in and look seriously at what needs to be done as far as renovation, that kind of thing.
Well, that's great. So 2026, that's the magic day.
That's right. And that building has about a little over 52,000 square feet.
I knew it was big, but I didn't realize it was that big. That's a lot of square feet.
I think Commissioner Davis said early on it was probably built about 1 acre, just about 44,000 square feet.
Wow.
And then an expansion was done on that particular property, in that particular building. That took it out to about 52,000. Now, how does that compare where we're currently, if you look at our Rocky Mount office and you look at our Nashville office and look at our case management office,
correct.
We probably total out about 27,000.
That's 27,000.
Is that right?
Okay.
27,000.
27,500.
So it's 27,500 feet versus 52,000.
So you got room to grow.
Yeah, that's right.
We do.
Well, that's awesome. I think that's great. So we talking about early spring, we talking about fall, kind of ish.
Well, we did talk about that yesterday.
We did. I think we're hoping early 2026.
Okay, sure.
We think that, Liz, we think there's probably a 6-month construction phase there. But of course, with a project like this, and we're talking about $2 or $3 million.
Sure.
It has to go out, advertised. The specs have to be fully developed, and then advertised for 30 days. You know all that part.
I know all about that. And then the other thing
bidding,
is, and then you have a number, and then who knows? We have tariffs that come into play, and all of a sudden commodity costs go up, or labor costs go up, and you have to rebid it. I mean, just all kinds of things that can be presented as a problem.
As a matter of fact, we mentioned that very thing, that tariff effect, what it will have on construction costs yesterday.
Yeah.
We're hopeful it'll move quickly because it's an entirely indoor process.
Right. Well, that's true.
So we'd hopefully be able to get some things done through the winter.
And our architects think we'll probably garner a pretty good interest level with maybe 6, 7, 8, 9 competitive bidders.
Okay.
So hopefully that'll bring price down.
Well, it should. That's the idea, right? Competition does require people to sharpen up the pencil.
And a construction company may very well like an indoor project as we approach the winter months next
I
month.
would think it'd be very easy to sell.
Yeah.
I would think it would be.
Yeah.
So anyway, we'll tell you a little bit about the community health prioritization assessment programs you guys got going on.
Liz?
Yeah, so we do a community health needs assessment. We do it every 3 years in partnership with UNC Health Nash. The state requires us to do it. The IRS requires the hospital system, the nonprofit hospital system to do it. So we work together.
Okay.
We're serving the same community. And it's a long process.
Yeah.
It starts, we do surveys. We surveyed about 550 people we got results back from. We're pleased with the results we got back, they actually pretty closely mirrored population demographics, so age, gender, well, more age kind of in that middle age. But and we ran a couple focus groups. So we collected all of our data, worked, put all that together, had the prioritization meeting last fall where we had maybe 50 community stakeholders come together, talked about all the findings.
Now, what does a community stakeholder look like? Let's let folks know what that means. So there could be a lot of things, right?
It could be, yeah. And we try to really bring together a nice grouping across sectors. So we tried to have school system represented, local government, private business, healthcare, average community members.
So all these data points that comprise the entire scheme or scope of society as a whole.
Correct.
Whatever you see in Nash County, you want to talk to them.
We're trying to make it a demographic kind of representation.
We do. And we actively try to search out folks who may not typically be involved in processes like this. I mean, in public health, that's one of the kind of magical things about public health to me. Having worked in medical care, seeing patients in the office one-on-one, right? Or in pediatrics one-on-one with a parent guardian. This is population level health. We are responsible to all 95,000 Nash County residents. And so we are trying to serve all of these folks in some way and help them achieve the health they're looking for themselves and their family.
Well, that's great. So what'd you find?
So we found 3 after all of that. After all of that, we had the meeting, crunched the numbers, and the group, not us at the health department, the group came up with 3 priority areas in no particular order. Economic stability, behavioral health with a focus on substance use and mental health, and access and quality to health care. So
how do you address those? I mean, they feel like universal issues and growing at some level.
And there is a plan where we do address those.
We're about to launch that in the near future here. We'll be calling on our community partners and stakeholders again to come together. And the next step in this community health needs assessment process we call it the CHIP. Or Community Health Improvement Plan. And so we work together as a group and say, okay, how are we going to address these priority areas? What kinds of things can we do? And Bill and I were just talking about this the other night. We're looking at maybe some system change. There's not going to be one program that solves economic stability, right?
Of course not.
The mayor would know that.
Yeah, of course not.
And
we talk about that too.
Yes.
and it's a long-term problem.
That's right.
I mean, Lyndon Johnson and the Great Society.
Well, he came through Rocky Mount to announce that, right?
And talking about how to address poverty.
That's right.
How to address those things. And all those really do gravitate around access to care, all the other kinds of things. I heard a British study just the last day or two that talks about morbidity, infant mortality, and all those things associated with, of course, it centers around lack of access to health care.
Well, it is one of those things that even if you're doing well, right, it's always going to present. You're always trying to get better. You're always trying to get better. You're trying to get better. So it never goes away by almost definition. We're measuring half-lives at some point, right?
That's right. That's right.
Yeah.
So what are so those are the 3 basic issues. I mean, what does that look like? Is that better or worse from where we have been, as you try to address these issues?
Well, I think we have made improvements over the years, and we sort of had a pause during the pandemic.
Well,
that changed our priorities, changed everybody's priorities.
Sure did.
And we had to continue to provide traditional health department services, whether it's child health, maternity care, family planning, STDs are still out there. But we, of course, still had to pause for these large vaccination clinics and testing clinics and things we had to do during that time.
Right.
But I think maybe, and hopefully, it has improved somewhat. We'd like to think we are going forward rather than going backwards.
Of course. But I feel like you are.
But we nowhere have anything close to a panacea that exists.
Right.
But we're not unique.
Right.
You don't have that in the World Health Organization. You don't have that in the United States, but we're trying to make those improvements.
Right.
At least I think when you hear people and hear about what their perceived concerns are, at least it does help us focus and crystallize more of those ideas that we need to put in place.
Right.
Yeah.
So.
And I think it's going to take collaboration and coming together. Things that we're starting, seeing already.
Sure.
So working together, I'm happy to say I'm really pleased to serve on the Tar River Transit Advisory Board.
Mm-hmm.
So transportation is
a big part of this, right?
Correct. It's a perennial issue for
and
folks.
And we're working on microtransit. We're also looking at a commuter bus system. We've got some grants, so we've been successful. And Carrie really has, has really led the process on this and trying to obtain some of those things. And so I think that makes a difference. But in this world of economic uncertainty, and we're looking even at cuts from the federal government, state government, when you overlay what you found, the chip, what is the plan? How do we, as a group, get to that place where we're able to be successful in the midst of what I believe are going to be some budget cuts for all of us? I think we're going to have a small recession going forward. Hopefully it's a small recession.
Yeah.
So what are your thoughts on that?
Well, we've talked about that as recently as the less than 24 hours, and I'm not so sure. That's because I'm a physically conservative person.
Sure, me too.
And I bring that physical part in there.
Me too.
I think there are some needed targeted cuts, but I add the word targeted, not just across the board hitting it,
Right.
But I think some targeted cuts probably are in order. I think there was probably a lot of money in the COVID time that might have gone into some wasted areas.
Sure.
But on the other hand, I think we always try to utilize those dollars as effectively as we can. I will say this, though. We have started talking a lot more with the hospital. I've had meetings recently with Dr. Lee Isley.
Mm-hmm.
We have Commissioner Wilkins and our chairman of our Human Services Board, Dr. Mike Johnson, who serve on both of our boards. They serve on the hospital board and they serve on our Human Services Board.
Okay, great.
So it's a great coordinating point, not to mention the meetings that we're having with the hospital and all trying to line up and make services much more available for our community.
Right.
Mm-hmm.
You were talking about the leadership.
Right.
When you look at the leadership we have, we were talking about that before
we were.
went on there with our chairman of the county commissioners, Chairman Mr. Wayne Outlaw, and Dr. Mike Johnson. They work so well together. The former chairman, Mr. Davis. They all work so well together. It makes it a much more concerted effort to be able to work with that kind of leadership.
Well, sure. In fact, I just left a meeting with Commissioner Outlaw, Chairman Outlaw, I should say now, and the outreach to try to find some sort of collaborative effort. How do you work together to solve? We're certainly not trying to solve health department issues or public health issues, but how do you deal with things like poverty? How do you deal with things like transportation? And how do you make it better? Where you can, and at the same time, how do you grow a tax base and how do you create a vibrant economy locally with opportunity? And so we have way too often and it's way too easy to get into your little silo.
Right.
And then just start fighting with each other. And so I think really the answer is trying to build how you build those bridges and how you start with a plan. How you start with a regional plan or a county plan or however you want to look at it. But it's just not just Rocky Mountain. It's not just Nash County. It's not just, we have these administrative units and they're important to, measure by, but we've got to look at this in a different way.
And I think that silo or the competitive turf issues are true in healthcare, not just in retail stores.
That's right.
But I think you certainly do see it in healthcare arenas.
You do.
We're there to be filling in the gaps and voids and provide those services might not be provided otherwise.
Sure.
Yeah. Well, and I feel like we're
you are the safety net for a lot of people.
We are a safety net.
In fact, if nobody in the private enterprise is doing it, y'all are really almost charged with that, right?
About 38% of all pregnant ladies of prenatal care come through the county health department.
Yeah.
So you're touching really 38% of the new population every year.
We are talking about 38%. And they feed into the hospital.
Right.
And most of our pregnant ladies, once they become pregnant, their Medicaid does cover most of ours in our clinic. So we send in not only for deliveries, but we have a built-in reimbursement for the hospital through Medicaid.
Right.
Most of them.
I understand. And then we're talking budget cuts there too. But anyway, we don't have time for all that.
Yeah.
Let's hit the highlights, right?
Yeah. I think we're getting some momentum in the right direction. Like I think of the United Way as leading this homelessness coalition that I know that the cities become involved in as well. But getting the right people to the table, having those conversations, building those relationships, and working together. And just in the year that I've been here, we've gotten to know, we do have some other safety net providers in the community. So Carolina Family Medical, OIC, getting to know their staffs and seeing how we can work together to maximize what we're doing with the dollars we have, the population we serve, transportation issues, all kinds of factors go into that.
And other than just the day-to-day activities like this, like maternity care today, especially Wednesday, in our Rocky Mount office, seeing doctors, and now providers, our nurse practitioners. But we are having to plan for those unseen emergencies, those emergency types of situations, whether it's a COVID.
Well, I was going to say, COVID is a classic example of that.
Yeah. And of course, we're looking at bird flu, H5N1, to see if that goes away. Now, there's a bill in the legislature. I was talking about this just yesterday about legalizing raw milk. The consumption of raw milk. Not on a large commercial level. But I'll just say this as succinctly as I can. If you have a choice between drinking pasteurized milk, that basically eliminates E. coli, salmonella, listeria, H5N1, bird flu, pathogens, bad stuff, as opposed to the risk factors. And I said yesterday, there's some possible minimum nutritional benefits from raw milk, but they do not outweigh the risk of drinking raw milk.
It's the reason we pasteurize it.
That's a reason. As Louis Pasteur.
That's exactly right. He was a good man.
He was a good man. Did some good work.
He did. Yeah, he did. All right. Well, they're playing the music, so we're actually done. So, but anyway, I know it doesn't take long, right, Poop? We had a list here about 20 things to talk about. I think we covered 2. But anyway, thank you for coming. It's always a pleasure. And
nice
good luck to you and much success. And anything we can do to help, let me know.
Thank you for your leadership, too.
Thank you, sir.
Absolutely.
Thank you.